This is a CJASN podcast, and I am Jian Roushani from McMaster University. With me is Dr. Peter G. Blake from Western University in London, Ontario. Dr. Blake is the senior author of the paper, Clinical Outcomes and Vaccine Effectiveness for SARS-CoV-2 Infection in People Attending Advanced CKD Clinics. We will co-present this podcast. It is well recognized that maintenance dialysis patients worldwide had very high case fatality rates in the range of 20 to 30% in the first 20 months of the COVID-19 pandemic. This is what we would now call the pre-Omicron period. What is less recognized, and what we show in our study, is that people with advanced CKD not undergoing dialysis had a very similar high case fatality rate. We examined a cohort of over 20,000 patients with advanced CKD who attended advanced CKD clinics in Ontario, Canada. Their case fatality rates were 28% at 30 days in the first COVID wave and 19% through the first 4 waves. These patients also had high rates of hospitalization and ICU admission.
Risk factors in this population for higher fatality included older age and greater comorbidity. Importantly, once vaccination was available, those who had already been doubly vaccinated by the time they were diagnosed with COVID infection had a markedly lower mortality, 89% less than those who were not vaccinated. The literature now shows that COVID-19 case fatality rates are much higher in people with CKD, and that the effect is particularly marked in those with more advanced CKD, stages 4 and 5, and those on maintenance dialysis. For those with CKD stage 3, other studies suggest that fatality rates are also high, but not to quite the same extent. It is unclear whether all this represents a direct adverse effect of impaired kidney function on outcomes, or whether it is mainly the higher rates of comorbidities such as diabetes and cardiac disease seen with more severe degrees of CKD that drive these bad outcomes.
Our study also looked at how the 3% of our 20,000 plus advanced CKD patients who were diagnosed with COVID infection differed from the 97% who were not. Those diagnosed were more likely to live in the more densely populated Toronto region of Ontario, to have non-white ethnicities, to live in lower income areas, or to reside in long-term care homes. This again emphasizes the predisposition to infection and to associated severe outcomes of socioeconomically disadvantaged populations during the first 20 months of the pandemic. Older age and greater comorbidity were also risk factors for diagnosed infection, but this observation may be confounded by the greater severity of disease in these groups, leading to higher rates of testing and consequent diagnosis.
COVID-19 has changed significantly in the Omicron era. Less severe disease, but much higher infection rates. But our observations from the early waves of the COVID pandemic are important. First, people with advanced CKD are an exceedingly high-risk group if diagnosed with COVID-19, and therefore need to be prioritized for vaccinations and other preventative and therapeutic strategies. Second, socioeconomically disadvantaged populations took a heavy hit from COVID-19 in the pre-Omicron waves of the pandemic, emphasizing yet again the importance of social determinants of disease. Thank you.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.